Let's go now to Associate Professor Margie Danchin, paediatrician and vaccine expert at Murdoch Children's Research Institute. Professor Danchin, good afternoon to you. This announcement today, it seems like it's been a long time coming, particularly when you consider how long this vaccine's been available for kids that age in places like the US.
Yeah, that's right. Good afternoon, Ben. I mean, that's right. The program did start in the US around June. And, of course, we saw the TGA approve the Moderna vaccine for this age group about 2 weeks ago. So I think it's really welcome news now that ATAGI have made their recommendations for this high-risk program.
So the TGA, the Therapeutic Goods Administration, gave approval for this paediatric vaccine. It probably needs to be explained that that's
yes.
not the same as the adult vaccine. It's a milder.
No.
It's a milder dose?
No, it's a smaller dose, so it's half the dose that's given to the primary school kids, and it's a quarter of the adult dose. So it's 25 micrograms, and it's 2 doses 8 weeks apart, although kids who have severe immunocompromising conditions get a third primary dose.
But in this case, the Therapeutic Goods Administration has approved it for children aged 6 months to 5 years, but then ATAGI, which is the body that decides who, how and when vaccines can be administered, had said, yes, but we're only going to give it to kids who have severe immunocompromised systems or who have severe disabilities. Why is that?
Well, so this is the decision. Is the vaccine recommended? And that is ATAGI's role to recommend how best vaccines are used in the population. The question to them was, should this be given to all kids, so a general program, or should it be just initially prioritised for high-risk children? And they have made that decision, and it's 3 main groups of kids. So it's those with a lowered immune system for various reasons, disability or complex health conditions. And, you know, that decision has been made sort of based on a range of factors, one of which is supply for vaccine in this age group, but it's also based on kind of the disease burden or epidemiology, if you like, in this age group, as well as, you know, a number of other factors in terms of the variants circulating and the effectiveness of the vaccine in kids in this age group.
Do you have any sense of what the demand is for the vaccine among parents of kids aged 6 months to 5 years old? Whether there will be some who will be going, I want this extended to all kids in that age group?
Well, that's a good question. And if we look at the primary school program in the 5 to 11-year-olds, you know, we've reached about 60% coverage of 1 dose and about 45% 2 doses. And it's sort of stuck there right now. So we know that there's going to be a proportion of parents that do not want to immunise their children, but we also know that there will be more parents broadly, not just parents of children with chronic medical conditions that would like access to the vaccine. And those parents would come forward first, a little bit like we saw in January this year when the vaccine became available. You know, on the 10th of January, there was a rush for many parents to vaccinate their primary school-aged children, and then it really tapered off when school started in February. So it's hard to predict exactly what proportion of parents want to vaccinate their kids, but I would say at least a quarter would be, you know, quite vaccine hesitant or refusing, but I would say the vast majority of parents would be interested in vaccinating their kids.
Yeah, so why? I mean, you've talked about the supply. I mean, this is why for the moment it's being restricted. Are there any downsides beyond that, or is it simply just getting hold of the vaccine and making sure there's enough to go around?
Well, essentially, we've got to look at benefit, and we know that there's a very low likelihood of severe illness in children in this age group from COVID infection. Of course, it's not zero, but we're weighing up risks and benefits here. So, for example, there's a low risk of hospitalisation. Of the kids that are hospitalised in this age group, about 3/4 have an underlying medical condition. So those higher risk kids are more likely to be hospitalised. Secondly, you've probably heard of that multi-system inflammatory syndrome disorder, that sort of severe complication of COVID infection in children called PIMS-TS. Well, that's decreased by about 90% with the Omicron variant, so that's become a lot less common. And then when we look at the actual efficacy or effectiveness of the vaccine in this age group against infection, it's only about sort of 35 to 52%. So that means that really, if you look at the benefit, the greatest benefit would be in children who are at higher risk of severe disease and going to hospital or ICU, if that makes sense. So broadly, the benefit for all kids is a lot less because they're just a lot less likely to get sick.
And is that why there's no third booster being recommended yet for kids under 12?
That is one of the reasons, yes. They're at low risk of severe disease and going to hospital. They don't need that extra dose on a broad scale to prevent them going to hospital. That is absolutely part of the reason. But also just to say that benefit equation that I just presented then has to be balanced against in this age group. So there was the Moderna trial had about 5,500 children, and fever was slightly more common in this age group compared to the primary kids and the teens. So about 1 in 4 kids got a fever, and that was higher in children who had a history of COVID infection. So we need to watch this space. We need to see if the vaccine may trigger some febrile convulsions. So, I mean, in terms of the risk of the vaccine, that was also part of ATAGI's decision making. Unfortunately, just quickly, the myocarditis, pericarditis, severe adverse event, that looks really low in this age group, but that will also be monitored closely.
Great to talk to you today. Thank you.
Thanks for having me.
Associate Professor Margie Danchin, she's a paediatrician and a vaccine expert at the Murdoch Children's Research Institute. On the news today that vulnerable children aged 6 months to 5 years will be able to get a COVID vaccine from next month, after the federal government accepted a recommendation saying exactly that from ATAGI.